Well, good morning. As I mentioned the other day, I said I'd be back and talking with you as we learn more about COVID-19 in Spokane. And so as you've probably learned, if you look at the DOH website, we have 3 cases that have now been confirmed in Spokane County. These are 3 Spokane County residents. There was one that potentially was ours. I'm not quite sure the status of that, but I can confirm that we have 3 individuals. The investigations are taking place right now as I speak about those 3 individuals. What I can tell you, what I know is that one is a woman who is in her 40s, who is symptomatic. She's feeling okay, but not feeling great. I have a gentleman in his 50s, and the 3rd case has not been yet identified or has not been contacted. So that's what I can tell you about the cases. What I can tell you is that since yesterday, the Emergency Coordination Center has been organized and will have its first meeting on Monday. This is one of our partner organizations that during a state such as this, we focus on trying to coordinate all efforts. And so that is an organization that is overseen by Sheriff Knezevich. And as this is a public health issue, he and I will be working very closely together to address this issue going forward. As I've mentioned previously, and as I will continue to emphasize, this is a collaborative effort. It's not only public health, governmental public health leading the effort, but also working closely with partners, with other governmental agencies to ensure the health of our community. I really want to emphasize, I guess, 2 things. First of all, we all talk about the need to breathe. And it was funny, this morning when I was running, I was thinking about breathing, but I don't necessarily want people to be breathing on each other. Because that, again, really emphasizes the whole concept of social distancing. Social distancing is something we need to be looking at, we need to be practicing. I also want to emphasize that this is not doing things exactly as we've been doing in the past. So I want people to continue to go about their daily activities acknowledging that they are going to have to do their daily activities somewhat differently. What that means is that they're going to have to look at social distancing, look at other options, maybe for work, such as telecommuting where possible. This does not mean stockpiling resources. It really just means looking at doing things a little bit differently. So I want people to breathe, but not necessarily breathe on each other. And also I want them to think about the fact that how is this transmitted? It's transmitted by me touching my face, coughing, sneezing, and then touching other surfaces. So those frequently touched surfaces should be frequently cleaned surfaces. So those are, again, 2, I think, important messages that people should hear going forward and really looking at. So with that, I'll be open to questions. Yes, sir.
Earlier this week, you said you knew it was here, there just wasn't any confirmation. So do you have any idea of how many more there may be in Spokane County?
It's really difficult to say. I mean, it's not as if I know I have 3, therefore I know that I have 30. What I can tell you is that as of this morning, and you probably all looked at the DOH website, Department of Health website, we had 642 confirmed cases, we had 37 deaths, and we had, again, the 3 mentioned here in Spokane County. We see this spreading throughout the entire state, and I think that, as I mentioned before, I knew that it was here, I just didn't have confirmation that it was here. We've had more negative tests than we've had positives. I think the thing that is of note is that we are starting to see these tests come in more regularly and more frequently, which is encouraging for me that providers are looking at the symptoms and determining that these individuals should be tested.
Are any of these positive cases in Spokane County connected to the Woodward community members being tested earlier this week?
To the best of my knowledge, no. And with respect to those individuals that was asked yesterday, they are still, unfortunately, the test results are still pending on those.
How long now about before we get a test back when someone sends a test? How long about until we're getting those back?
The one test, the first one that I was made aware of today, the turnaround time was 3 days. So that's very encouraging. That's very encouraging.
So, do we know, and is this, it's too early, that's okay, but do we know if these cases are people who are travelers, were they in contact with someone that could have been, or are you treating this as community spread?
The one case that I know of had no travel history. There was, however, contact of that individual with someone who had been in Seattle. I can't tell you anything about the other case that is beginning to be identified, and again, the third person has not been yet contacted.
Are these patients going to just self-isolate, or are they going to maybe go to Sacred Heart with the resources they have over there?
No, again, I think all three individuals, to the best of my knowledge, are not necessarily requiring hospitalization. So to date, the one person who has been contacted by one of our epidemiologists was told to self-isolate, which would be the guidance that we would recommend for anyone who is identified and who is ill, who is positive for COVID-19, but is not sick enough to be hospitalized.
How many tests in Spokane have been done?
I knew you were going to ask that question. I need to hear the answer.
70.
So to date, there have been 70 tests. There have been a lot of tests done. We've had 70 negative tests. So I have 70 negatives and 3 positives as of this time.
I know you said that stockpiling for like years worth of supply is not exactly necessary, but do you recommend people keep supplies on hand, like maybe the 2-week guideline that we've been seeing?
Yeah, I would again encourage people they always should be prepared. I think to some degree, people should look at having a preparedness plan, irrespective. As I mentioned yesterday, we know in the Inland Northwest we've had plenty of natural crises, so people should be prepared accordingly. So I think having that kind of guidance, and that kind of preparation is really important. I think I would also just note that we have a lot of resources on our website, and so for those who do have access to the web, using the internet, using srhd.org, a lot of that information is already available to them.
So, I mean, obviously the west side was kind of hit first and the hardest. So are you guys, I don't know, working with other states? Is this kind of spreads across the country? Is this like, or are we kind of self-contained here in Washington working on just us?
Now, so the question is about how much interactions we have with other states. I mean, certainly we did have the first case. We continue to have the most number of cases. At the Department of Health level, they are closely coordinating with other states as well as with the CDC. For us locally, our next resource is the Department of Health.
How are we doing as far as hospital capacity to take on cases?
Yeah, that's a great question around hospital capacity. And that's why, again, if you think about that epidemiological curve that I shared with folks yesterday about the pandemic, I want to be on that flat curve as much as possible. Right now we have capacity. What we're trying to do is be proactive to prevent the capacity from being overwhelmed. So at this point we're doing well, but we certainly have our partners on the west side to learn from, and they were overwhelmed because of the quick onslaught of which these cases came. So the earlier and more prepared we are, the better we will be to deal with the issues.
So those 3 individuals, have you guys, I guess, contacted other people that they've been in contact with or places that they've been to?
So that's all part of the contact investigation. So simply put, when we learn about a case, the very first thing we do is we contact that individual. We find out more about that individual, and then we start looking at it like sort of like a pebble in a pond, the ripple. And we look at those ripples and how deep and how far do those ripples spread. And so that's all part of the contact investigation.
Are any elective surgeries being canceled, or are those going to be?
Yeah, again, that I'm not sure of. I mean, I would certainly encourage individuals who have elected surgeries to consider postponing those because they are just that, electeds.
You mentioned our number of negative cases. Does that mean there has been more coordination now between healthcare providers, Department of Health, private companies, the testing? Explain to me a little bit about testing numbers reporting. It seems like that has ramped up and gotten better. Are you encouraged by that, and how's that working now?
Yeah, I'm certainly encouraged by the fact that I'm seeing more testing. It's not necessarily a coordinated effort, however, from the standpoint of us being in contact with providers. It's more, we send out provider alerts. So for example, a new alert went out yesterday to providers, giving them sort of a more liberal testing criteria, and hopefully taking that as means by which they know that if somebody comes in with a compatible history, and quite honestly, compatible history for me is if you've got fever, if you have lower respiratory tract symptoms. As a provider, if you're thinking about flu, you should be thinking about COVID-19. And so that's a message that I think providers should take home. If they're thinking about flu right now, and we know there is an uptick in flu in our community, then you should also be thinking about COVID-19 testing.
Do you know if any of these 3 positives were at or involved in safety?
I do not. If no further questions, then we'll call it a day. Okay, thank you.
So early on, you mentioned 3, and then you said one case that we're not really clear about. Was that the 3rd case, or was that a 4th case?
It was the 4th case. Initially there was 3, and there was 4. Then when we looked at the 4th was actually in another county.
Oh, you thought it was a Spokane County case?
Yeah.
But it turned out